What is sepsis? Sepsis is a life-threatening reaction to an infection. It happens when your immune system overreacts to an infection and starts to damage your body's own tissues and organs. You cannot get sepsis from another person. Who can get sepsis? Anyone with an infection can get sepsis. Some people are more likely to get an infection that could lead to sepsis, including babies under 1, particularly if they're born early, premature, or their mother had an infection while pregnant. People over 75. People with diabetes. People with a weakened immune system, such as those having chemotherapy treatment or who recently had an organ transplant. People with a genetic disorder that affects their immune system, such as people with Down syndrome or sickle cell disease. People who have recently had surgery or a serious illness. Women who have just given birth, had a miscarriage or had an abortion. If you are more likely to get an infection that could lead to sepsis and you become unwell, get medical help as soon as you can. Let the medical team know about any conditions you have or reasons why you might be more at risk. You cannot get sepsis from another person. It happens when your body overreacts to an infection. How to help prevent infections? It's not always possible to prevent sepsis. There are things you can do to help prevent infections that can lead to sepsis. Do's. Keep up to date with vaccines, particularly for babies, children, older people and pregnant women. Clean and care for any wounds. Take antibiotics correctly, follow the instructions and take all your prescribed antibiotics, even if you feel better. Wash your hands regularly and teach children how to wash their hands well. Do not ignore symptoms of sepsis. Treatment for sepsis. Sepsis needs treatment in hospital straight away because it can get worse quickly. You should get antibiotics within 1 hour of arriving at hospital. If sepsis is not treated early, it can turn into septic shock and cause your organs to fail. This is life-threatening. You may need other tests or treatments depending on your symptoms, including treatment in an intensive care unit, a machine to help you breathe, ventilator, surgery to remove areas of infection. You may need to stay in hospital for several weeks. Recovering from sepsis.